Hi, and welcome to Central Maine Heart and Vascular Institute at Central Maine Medical Center. My name's Dr. Paul Wellner. When I got here, I was amazed at how beautiful this hospital is and all the high-level surgeries that are happening here. Immediately, I knew I belonged here. I'd like to show you around so you can become as comfortable with Cmhvi as I am.
Well, this is just an awesome unit to work in. We're focused on the cardiac patient from all aspects, from cardiac intervention through cardiac surgery. So we certainly are specialized care from the heart for the heart. Well, certainly when Dr. Wellner came to interview for the position, he did get a chance to meet with all of the colleagues that he'd be working with, but also get a chance to meet one-on-one with our nursing staff. And they just hit it off. Within an hour's time frame, they were joking and laughing, and you could really get a sense of his personality and his deep caring and compassion for his patients.
I'm loving it. I've been here since November, and it's been an experience that has just brought smiles to my face and changed my life incredibly because of the fact that the team is just so wonderful to work with. And the patients seem to enjoy the atmosphere of having their operations done here, and from the nurses to the people that clean the rooms to the administration, it's just an environment of people just wanting to do the best for the patients. And so that's, how can you not enjoy being in an atmosphere like that? I was trained in doing baby heart surgery, so I love that close connection that a physician can have with patients, and it was getting lost. And so, yeah, there was always, this program up here in Lewiston, and you would hear that it was a smaller program. I always heard that they had good results, but then an opening occurred, and I chatted with Carmine, my partner, Frumanto, and after meeting him and learning what kind of a great individual he is, and he also believes in the same kind of care that is more on a personable side rather than just cut and sew and leave them to get better on their own. And so coming here and seeing what I could get back to my roots, so to speak, being able to provide that kind of care was incredible.
Right from the very start, starting with administration, trying to figure out how to best form a heart institute here at Central Maine. There was many aspects from the administrative side that they had to address, but one of the key features that they found at successful heart programs when they were planning this program was a team approach. Well, what does that mean? That means that your surgeons, your nurses, your anesthesiologists, your respiratory therapists are all working together basically, and with good communications, without barriers to communication. And that really started right from the very beginning. I believe you saw some of our family-centered rounds, so the patient and the families are part of that team as well. It's not just the doctor and the nurses telling you what to do. We want to get the patient's perspective and how things are going, and how it doesn't end when you leave the hospital. There's follow-up appointments through our office. Our nurses will be calling a day or two. Our physician assistants will be calling as well. You'll obviously see your physician back in the office and follow up as well, and pretty much any time should any issues arise. But the point of a team approach is that make sure everybody knows what's going on, including the patient and the families, and to try to provide the most efficient and highest quality care. And I think a team approach succeeds in that. I think we established a successful program. I don't think anybody can deny that based on our results. On the other hand, what's the next step? And the next step is not to just sit on our laurels and say, okay, we can do this. It's what else can we do? And I think having the opportunity to get Paul Wellner up here really helps us to take that next step forward with all his minimally invasive cardiac techniques that he brings to us. So we really saw that as a great opportunity for us to continue to move forward, not to just sit on our laurels again and say, yeah, we can do bypass surgery and we can do basic valve surgery, but what else can we provide to our community? Why not bring state-of-the-art care to our community? I think Paul Wellner really does that.
As a nurse, I was really glad that my parents, when they moved back from South Dakota to Maine, that they chose to be in an area with such a great heart and vascular hospital nearby. My dad had a mild heart attack last year and had to have a cardiac procedure, and came here, and they took excellent care of him. So in the last year, my mom developed AFib and needed to have a cardiac ablation. So when we realized that she needed to have that procedure, we were really comfortable having her come back here because my dad had received such excellent care. So we've been really happy. The nurses here are excellent. They're always giving families the update. The doctors come in, they talk to the whole family, not just to the patient, and make sure everyone's comfortable with the teaching, with what's happening, make sure everyone understands what discharge care needs to happen. It's been great. You're really included in what the care is. It's not hidden. You know, they're giving you all of the information. They're talking about the procedures. They're talking about medications and really including you in what your care looks like, what the plan is forward, what they've done, and where that's going to go.
I think the impressive record that we have here at Central Maine Medical Center for safety and high quality outcomes directly relates to the team nature between the physician anesthesiologist, our cardiac surgeons, our perfusionists, and the rest of the surgical team, including the intensive care unit nurses. Everyone does an excellent job. The communication is flawless, and we offer great patient care.
I've been here to help basically get the program started. There was nothing here at the time, and just have enjoyed the way it's grown over the years and the way they've approached the concept of treating patients here. It's very personal with the model of the single stay unit, and just it's a small team, so it's a comfortable place to work. You don't feel like you're in a factory rushed all the time, which is nice.
Patients figure out that it isn't just that they're a number. It's a bit of a homie. We're friends, we're sisters, we're kindred sisters. And they walk away with knowing that they've gotten the best of care. They can see the respect of the physicians to the nursing staff and the CNAs. They can see the respect to the other ancillary departments. And oftentimes we fight over you. Who's going to get you first? I usually win out. But yeah, so the team approach is what makes or breaks a hospital stay. And patients and their families feel like they're part of the team also, because they really are. We need the family members to be engaged with what the game plan is. The walking. It's tiring to walk a lot, but we get family involved. So I think single stay concept is a unique concept. You don't see it in any of the other hospitals around this area. And trust me, you'll enjoy it once you get here.
The Arbor House is a facility that we have. It's actually just the very next block from the hospital, and it's where family can stay for extended periods of time if they travel from afar. Maine's just a really big state in itself, so they don't necessarily have to come from out of state in order to stay there, but I think we do a really good job of meeting their needs. We're in phone contact with them, and they're just so close by. I think everybody really kind of enjoys staying there if need be, and it's something that's very easy to set up. We can do it when the patient arrives on the floor. We can do it before the patient arrives here in the hospital. We just need to know the needs that need to be met.
You walk in here, and I mean, I really didn't have anything with me to stay overnight, but they provide everything. I mean, there is shampoos, deodorants, towels, whatever you need. And it's very comfortable, and my husband has actually enjoyed it, so we do not travel back and forth. We come down on Monday afternoons and we go home on Fridays. And it's just unbelievable. It's so comforting, and it truly is like your own home.
When you come into the hospital, you arrive in one room, and from the time you come and to the time you go, it's that same room. So your families aren't being hustled all around a hospital from one unit to another unit. Here you're all in one place, and the rooms are very modern, high-tech, but also very comfortable. Family members can stay there overnight right next to their loved ones. So I really think that it's a perfect combination.
It's your room, you have your own bathroom, you have a closet, there's a nice sitting area for family. And so I think you get to feel like you're part of us, part of this home, and I think that makes patients feel better. And it's the same nurses over and over again, the same staff, us who are always up there seeing you, So I think it adds so much more than just saying, oh, we're going to transfer you to the other part of the hospital and we may not see you on a regular basis. By being in a single stay unit, I can see a patient 5, 6, 7 times a day because we're constantly running back and forth to check on people and be involved in their care.
September, I'm having a regularly scheduled stress test. And at the conclusion of the stress test, the physician said, we see a small anomaly, and recommended that I have a nuclear stress test. So during the nuclear stress test, you're supposed to let them know about a minute before you're done, because they then inject you with this nuclear dye and they take pictures that start to represent about 90% as accurate as a heart catheterization. And they showed, and I was fine, I had no pains, I was 12 minutes on the treadmill, and it showed that half my heart wasn't receiving any blood during motion. So then they scheduled the catheterization, and Dr. Phillips from Cmhvi did my catheterization, and at that point, and we're awake during that, and he's suggesting that bypass is in my near future. At that point, I really haven't come to terms with the idea that I'm 53 years old and I'm going to be going through a bypass surgery. I'm still looking for stents or for some other option. But between Dr. Phillips and Dr. Frumiento, Dr. Frumiento I had met for the first time, I had complete confidence during that meeting that these surgeons could do my surgery, that I would have a great recovery, and it would be best for my family to recover at Lewiston. I had the option, just because of my family history and good insurance, to be able to go pretty much anywhere I wanted. And I wanted to be in Lewiston having this surgery, and in hindsight I was right. It was the right place, and I'm not going to say it was a great experience, because I'm sorry I had to go through it, but having gone through it, it was a great recovery.
I've never had the opportunity to work at a place such as Central Maine Medical Center that has a single stay unit, and I find working here that it provides a much more closer care. I am able to provide a better service to my patients and to their families, and where they're not being transported across different departments in the hospital, they receive all their care in one room, and I feel that they are better in tune with the staff, the team, and certainly what I can provide as a clinician to help them through their surgical course here, and then being in the same environment and just not being off the floor into different places that they may have to meet other people more frequently. They're much more closer at home, closer to the heart.
When you're going to be making your decision to have your heart surgery, it needs to be in a place where the whole team is motivated for you to do well. And that, I can assure you, is what occurs here at Cmhvi, and the reason why I came. And the second thing that you really need to be to know or to be looking for is a very experienced team. And I think that I've performed more of the adult heart surgery here in the state, let alone New England, for the past 15 or so years. And so I think having your heart surgery done by an experienced physician, a caring and very motivated team in an atmosphere and a facility that's modern and very comfortable, it's only going to make your entire experience one that you can look back on and be happy that you had it performed here at Cmhvi.